COVID-19 pandemic has created much emotional devastation. Healthcare workers are losing their patients every day, and increasingly more families are in mourning. There is also the stress of not being able to visit your loved ones in hospital or in quarantine. To discuss the emotional issues brought about by the pandemic, clinical psychologist Ruth Ancer joins me now for a conversation. And Ruth, this has been, we are headed for almost a year since the lockdown went into effect, initially in very dramatic fashion, coupled with patrols by members of the SANDF and the police and strict enforcement. The enforcement may be sort of easing a little bit as we go through the levels, but the psychological effects of it all are not, especially with the grief that many people have been facing.
No, absolutely. I think that COVID and the consequences have had something we could never have imagined a year ago, in terms of the stress and the anxiety and incredible loss and the isolation that so many people feel. And I think what's been incredibly hard is that with vaccines coming, there is a light at the end of it feels like there's a light, but for so long, it's just, at the beginning it was a sense of, okay, we've got 5 weeks of a lockdown, and it's prolonged, and now with the second wave. And I think that in terms of mental health and emotional well-being, it's had a devastating impact on so many people in a multitude of ways. And not just from the physical perspective of illness, and not just financially. Of course, that adds to it. But in terms of mental health, it has been it's been a crisis. And a lot of people are struggling in so many ways.
Let's talk a bit about the element of grief and perhaps the shared grief, right? Because while we may be physically apart, many of us are digitally connected, Ruth, with the result that, it's not uncommon to know of someone who is either, a friend on one of the social media platforms who's going through grief, and this is happening on a daily basis. What is the impact of this shared grief? Is it that we are sharing the burden and in that way able to deal with it better? Or is it that actually we are even more burdened in that we are even aware of the passing on of people that in many instances we may not have known directly?
I think it's a combination. I think for a lot of people, because there's been such a strong reliance on technology and connections, there's been opportunities to participate and engage with people about shared losses that maybe we didn't do before. And I think that has been for families and people who are in grief, that sense of a lot of people caring and reaching out, I think makes the grief feel maybe slightly more manageable because there's so much support. But I also think you're right. Because of what is happening and because we're so connected, we are hearing about deaths and losses of people connected to people that we wouldn't have been aware of, which does make us hyper alert to what is going on. So I think it's both makes things harder, and I think it can also make people increase the number of messages of support. But what is really difficult is the way that the COVID and the restrictions have placed on cultural and religious practices in terms of grief and loss. So we've got the limited amount of people who can go to funerals, and there are limited ways that other people, in terms of their physical presence, can show support, which I think can be very isolating for the families. But on the other hand, there's been a lot of funerals and prayer services that are shared digitally, which means that people who wouldn't have been able to take part maybe in different parts of the world have been able to participate as well. So I think we can look at it both ways, not minimizing how hard it's been and what we've lost, but also by embracing the fact that there is a wider opportunity for support from people and for people to be involved in functions and processes that we might not have thought of doing, engaging people technologically. But I think that the sense of grief is overwhelming. So many people, I know so many people who have died or who are battling and who are sick. And that sense of anxiety and worry about people really does take its toll. And we are seeing grief, and in some families, not just one person, but generations of people where, family members are suddenly, the family structure is suddenly very different because of the impact COVID has had. And I think it all does take a toll, and it really does mean that
we do seem to have lost the connection to Ruth Ancer there. Ruth, I believe we have you back. Lastly, Ruth, as you were describing there, the challenges around the being in the same physical space and the impact of not being able to do that, I'm just wondering, in terms of psychological, services, such as those provided by your profession, how effective can this be done in a period like this, where physical presence is a problem?
There's a very important role that counselling and therapy can help at times like this of isolation and grief. And it's about connecting to people either in the private sector or the organisations. There's a South African Depression and Anxiety Group, and there are organisations in our community that are offering support.
Yeah. All right, we have completely lost Ruth Ancer there. She's a clinical psychologist. But I think we got enough out of that, right? Do seek out people that may be able to assist. Speak out about these issues. It is a tough period. We are all facing a really difficult period, and there's no shame in it, really, in terms of the psychological and emotional impact of the losses that we're facing around COVID-19, physical, emotional, and things such as your livelihood. Losing your livelihood, as well as the isolation of it all. So do reach out to people if you do need to get extra assistance. It really is important. Look after yourself.